Hello everybody, welcome to Dr. Sam's Anatomy classes. Myself is Dr. Azmi Mohsin, Professor of Anatomy, and I'll be teaching you about the olfactory nerve today. It's the first cranial nerve, you know it, and it's a pure sensory nerve. So this functional component of smell is categorized into two categories according to different authors, different scientists. Some say that it is a special somatic afferent, and that is because the olfactory epithelium that develops from the ectoderm, and that's why they call it to be a special somatic afferent, just like the vestibular nerve, the cochlear nerve, the optic nerve. Similarly, they consider that olfactory nerve should be categorized as special somatic afferent. And there are scientists who support this as special visceral afferent. They consider because it of its functional involvement, it's like interrelated with the taste pathway, very much closely interrelated with taste pathway, because if you are not smelling something, you cannot relish the taste as well. So that's why and because of smell, there is secretions in the salivatory and the gastric secretions because of smell. So considering the functioning of this olfactory nerve, that the results that it bring about is same as that of taste. So they have categorized it as special visceral afferent. So there is still a debate over to this functional component. Okay, so now we'll be discussing about olfactory nerve in detail. Before that, let's see that from where it's arising, right? You must be knowing that out of the 12 cranial nerves, first and second nerve, the olfactory and optic nerve, they arise from the telencephalon, that is the forebrain. Then remaining of the 10 nerves, from 3rd nerve to 12th nerve, they all arise from the brain stem, right? This is the brain stem, midbrain, pons, and then medulla. All of them from 3rd to 12th nerve, they arise from the brain stem, while this olfactory nerve and optic nerve, they arise from the telencephalon, from the ventral aspect. And before telling you the details there, let's summarize the important peculiar points about olfactory nerve, because that will make it interesting. So point number 1, the peculiar features I'm telling you about olfactory nerve. One thing is that you are seeing it's the smallest cranial nerve. If they ask is the smallest cranial nerve, then it's olfactory nerve. If they ask which is the largest cranial nerve, then your answer will be trigeminal nerve. Trigeminal nerve, it's the largest cranial nerve. Then of course it includes both sensory and motor roots. Then if it's asked that which is the longest cranial nerve, your answer will be vagus, right? If it's asked which cranial nerve has the longest intracranial course, then your answer is it's the trochlear nerve, which has the longest intracranial course, because it's the only cranial nerve which arises from the dorsum of the brain stem, and that is from the level of inferior colliculus of the midbrain. But still there is a dispute over to this also. Some authors have written that the largest intracranial course is that of abducent nerve, because it emerges in the posterior cranial fossa, it climbs the petrous, then it passes the cavernous sinus and all. So some authors say that it is this nerve, or majority what I have seen is people advocating about this trochlear nerve to be having the longest intracranial course. Then about which cranial nerve is most commonly involved in increased intracranial pressure. So if in case of increased intracranial pressure, it is this abducent nerve which gets stretched, and because of that there will be medial squint. It's the muscle, it supplies lateral rectus. So in this case there will be medial squint. That of course can be a false localizing sign in case of false localizing sign of the abducent nerve injury, but the reason might be increased intracranial pressure. So these are the few points about nerves, cranial nerves. Now to tell you about the peculiar points about olfactory nerve. Olfactory nerve, first of all, the name itself is a misnomer. Why misnomer? Because it's not a single nerve. There are around 16 to 20 nerves on each side. This you seeing is the olfactory bulb, and from the olfactory bulb down below, these are around 16 to 20 nerves which pierce the cribriform palate and reach down into the roof of the nasal mucosa. And so one thing, it's not a single nerve. There are 16 to 20 nerves, and they're all unmyelinated nerves, right? Another thing is that it's supposed that it's an extension of brain. This portion you are seeing is the medial and lateral olfactory stria, then olfactory tract and olfactory bulb. All this is like covered by the meninges, surrounded, and it's surrounded by subarachnoid space and CSF. So just like CNS is covered by meninges from all the sides, this much of the portion of olfactory nerve, olfactory bulb and tract, that also is covered by meninges and CSF. So it's an extension of brain. And not only this, the three pure motor nerves, the optic nerve as well as vestibulocochlear nerve, they also have this extension of pia and all the meninges and CSF surrounding to them. Okay, then another thing is that if it's asked which surface of the body, you find that the neurons are exposed onto the surface. This is another important point about olfactory pathway, that in the roof of the nasal cavity, the olfactory mucosa is there. From the lateral sides, you have this sphenoethmoidal races on both the sides, above to the superior concha and onto the roof. This mucosa is for smell, and which is around 2.5 centimeters square. That much area you find that the first order sensory neurons, they are exposed onto the surface, covered by a thick layer of mucosa. Then another point is that receptors, the olfactory receptors, other receptors, they were well specialized receptors for any other sensation, exteroceptive or special sensation, well organized, specialized receptors. But here in case of olfaction, the receptors are the first order neurons themselves. So the neurons, the first order sensory neurons themselves behave as the olfactory receptors. They have their free nerve endings in the mucosa, and they are to perceive the smell. Okay, then other sensory tracts you must have studied in the spinal cord, and even for this visual, hearing, vestibular, taste, all the sensations, they require at least 3 to 4 ascending neurons to reach to the primary sensory areas. It's only this olfactory pathway where only 2 order neurons, first and second neurons, are required. Only 2 neurons are required to reach the primary olfactory area. Got it? So this will be another important point. And smell is one important sensation that bypasses the thalamus or the gray matter or the nuclei similar to thalamus. So it doesn't reaches to the thalamus to reach to the higher centers. It simply bypasses thalamus to reach to the higher centers, not even like the MGB and LGB in case of auditory and visual pathway. So it does not reaches to thalamus either to similar gray matter as thalamus. It bypasses thalamus. Got it? That's another important point. And then, yes, very important point, you must have been taught about, like, you know, that nervous system, once it is fully developed, the neurons lose this the power of regeneration. So neurons do not divide when injured. Got it? But it is only this area, the nasal mucosa, the first order olfactory neurons, they die out, they keep replenishing, right? So these are the neurons which are, you know, abundant in number, and they keep on dying out and they keep on regenerating, and the new neurons keep on coming up. So that's this speciality is again an important point about the olfactory pathway, that these are the neurons, the first order sensory neurons, they have the power of regeneration also. So another point is that about the primary olfactory areas are important is, like, you know, the brain, the neocortex, the cerebrum I'm talking is composed of, you know, 6 layers. There's 6 layers in the cerebral cortex, but only in the olfactory area there are only 3 layers. Okay, so these are some important point about this olfactory nerve you got to know. Now we will study about the olfactory nerve in detail. Okay, now look here, this is a sagittal section, right? And here you finding is the nasal cavity. This is the roof of the nasal cavity formed by the ethmoid, and you know, this ethmoid has a cribriform palate through which it communicates the nasal cavity to the anterior cranial fossa. And over to this cribriform palate in the intracranial fossa, these are the olfactory bulbs that are placed, and which proximally continues as olfactory tract. Now from this olfactory bulb there are around, you know, 16 to 20 million neurons. These are the first order sensory neurons. You can see these neurons, their cell bodies are placed here in the mucosal layer outside below into the nasal cavity. So they have their peripheral processes in the mucosa, embedded in the olfactory mucosa in the upper 1/3 of the nasal cavity above to the superior concha. And these 16 to 20 million neurons, they group, they join, and they form small little bundles, and those are called fila olfactoria. This fila olfactoria then emerges through the cribriform palate and reach to the base of the olfactory bulb. So fila olfactoria is another name for the olfactory nerve, right? Nerves, you know the definition. Nerves are something that is the peripheral extension of CNS, right? And they should be covered by Schwann cells. Here they are not covered by Schwann cells, they are unmyelinated fibers. So these are the what is actually fila olfactoria or the olfactory nerve. It is the central processes of the first order sensory neurons, which are unmyelinated. They are grouped and bundled, and imagine 16 to 20 million they collect to form only 16 to 20 olfactory nerves only. And one important, this is on one side, unilateral, right? Most of the books, they don't mention like if it's of one side or collection of both the sides. So let me tell you, this what I'm telling is of only of one side of the nostril of the nasal cavity. So receptors and the first order neurons. They are the same thing. Remember, first order neurons, their peripheral process themselves act as the receptors. So okay, olfactory cells are 16 to 20 million bipolar neurons, right? The first order sensory neurons are bipolar in case of special senses, and these are receptors as well as they are the first order neurons. The olfactory nerves, you can see, is 16 to 20 in number. Therefore, this olfactory nerve, they are also called as fila olfactoria. These represent the central process of the olfactory cells, which pass through the cribriform palate. And these pass to the through the cribriform palate and make synaptic glomeruli with the cells of the olfactory bulb. So they, when they'll reach into the olfactory bulb, they will synapse with the second order neurons, and those are the cells of the olfactory bulb. Mainly it's the mitral and tufted cells in the olfactory bulb which form synaptic glomeruli with the first order neurons. Okay, now you're seeing here that a little zoomed up thing here. You can see this portion here has been zoomed here, right? So you are seeing this is the nasal mucosa, the roof of the nasal cavity. There are lots of fine thread lights. These are the peripheral process of the olfactory cells, receptors, the first order neurons, and the central processes pierce the cribriform palate and they get buried into the olfactory bulb. So this olfactory tract, you can see when it reaches behind towards the cerebral cortex, it divides into lateral and medial olfactory stria, and in between you have this anterior perforated substance. Okay, now look here, this thing which has been zoomed out here, this portion here is the nasal mucosa, olfactory mucosa in the roof of the nose. This olfactory mucosa has different types of cells. You have these, you first of all look at this. This is a mucosal gland called bowmans glands. This gland secretes mucosa on outside, right? So the nerve cells, the peripheral nerve endings, they are buried into this mucosa, thick mucosa. Around 60 micron is the thickness of this mucosa, right? And I told you the total area of the nasal mucosa, olfactory mucosa, is around 2.5 centimeters square in the nasal cavity. Then the different type of cells, the yellow colored ones, you can see these are the cytons of the first order bipolar neurons, and their peripheral nerve endings, they form thickenings of the granules, and then they find thread like nerve endings which are embedded in the mucosa. And to support these cells, you have the supporting cells in between, right, which will have microvilli here, and the basal cells also. Basal cells will be not reaching to the full length, rather at the base, and they will be for the replenishing of these neurons, right? So they are basal cells as well. Then you'll find that this is the basal thing, epithelium, and through which these neurons now they will collect, they will form a bundle, right? So thousands of neurons, they together form bundle, and this is called fila olfactoria or olfactory nerve. This is olfactory nerve, but because they are 16 to 20 in number on each side, so it becomes a misnomer. So the better way of calling it is olfactory nerves. So they emerge from the cribriform palate, then over to that cribriform on the cranial side, you find this olfactory bulb placed here, and in this, these are the central processes of the olfactory nerves or olfactory neurons, first order neurons. They form these glomeruli, and through these glomeruli, these are the mitral cells which synapse with these, as well as there are tufted cells, mitral cells and tufted cells form synaptic glomeruli, and these mitral and tufted cells sense their central processes towards the primary olfactory cortex. Okay, now you will see that this has been focused is the green color thing, the olfactory bulb. Now olfactory bulb, I told you, has different type of cells. The important cells are the mitral and tufted cells, right? So mitral and tufted cells ke bare mein you'll study that these are the second order neurons of the olfactory pathway, and they give off fibers from the olfact, which form, like the central processes of these mitral and tufted cells, they form the olfactory tract, and they reach to the primary olfactory areas, right? Primary olfactory area is this anterior perforated substance, this periamygdaloid area, and there are very minute nuclei embedded under structures surrounding, prepyiriform area, periamygdaloid area. So those are the areas here. And this, the darkened area is the uncus. So this will be the secondary olfactory area. So between secondary and the olfactory tract, this area is the primary olfactory area. So there you find this green color thing. They have zoomed out is the olfactory bulb. Okay, now a little more here in detail you can see, which we're talking about is this olfactory mucosa, epithelium. You can see the different types of cells. First of all, look at this gland. This is olfactory gland. These are also called as bowmans gland, and they secrete the mucosa which covers the olfactory epithelium. It is around 60 microns in thickness, and the area that it covers is around 2.5 centimeters square. Then these colored cells are actually the bipolar first order sensory neurons of the olfactory pathway. These are actually first order neurons, as well as they themselves are modified receptors. So you can see that these receptors, the peripheral processes which reach to the mucosa, they have the olfactory vesicles here, right? And from that olfactory vesicles, there are olfactory hairs which are embedded into the nasal mucosa. These are actually receptors for the smell, right? So then these are the central processes which ascend. First of all, they will bundle up with thousands of such neurons, and they will form olfactory fila, olfactoria, and around 16 to 20 bundles, that's called olfactory nerve. They reach into the endothelial fossa and get embedded in the olfactory bulb to form synaptic glomeruli with the tufted cells as well as the mitral cells, right? These are the mitral cells, and then you have the tufted cells also. Okay, so then other cells you can see here, these other cells are the supporting cells. Supporting cells are also having the microvilli and embedded here in the mucosa, right? So the all purpose is not only bowmans, but this also is secreting through the microvilli. There is a sense of tactile localization as well. Then there are the basal cells. These basal cells are actually, remember, progenitor cells. That's why I told you in the beginning that this nasal olfactory neurons, they have this power of regeneration through the help of this progenitor basal cells. Okay, so these olfactory nerves, they cross here the prepyiriform palate, and now you'll see these are the glomeruli, olfactory glomeruli formed between mitral and tufted cells, and there are this periglomerular cells as well as stellate cells also. And then the central fibers from the cells of the olfactory bulb, they together form olfactory tract, right? However, few of those olfactory fibers, the second order fibers, they might synapse here in the just junction of bulb and olfactory tract, and that's called anterior olfactory nucleus. Few fibers, majority fibers, they pass straight to the primary olfactory areas. Okay, now a cross section of the coronal section of the olfactory bulb. This is how olfactory bulb is. It is made up of different layers, 6 layers. Like layer of the olfactory nerve fibers will be below, of course, because from here this is the central processes reaching up. for the first order neurons. So this is the layer of olfactory nerve fibers. Then you have the glomerular layer. The second layer is the glomerular, the synaptic glomeruli, right? Then you have the molecular layer, like the granule cells. There will be this this layer are called the molecular layer, and then there will be a mitral cell layer, right? And then medullary layer, and this much portion was the cortical layer, and then it's the medullary layer, and finally the white substance, which is the ventral part, and the white substance is basically made up of neuroglia, and this is the dorsal part of the white substance. So in the uppermost limit you'll find is this neuroglia embedded, microglial cells, astrocytes and all, oligodendrocytes and all. Now this is about olfactory tract. You have been taught about the olfactory epithelium, olfactory bulb. Now look here, the second order neurons from olfactory tract, the mitral tufted cells and the central processes, when they reach towards the forebrain, it actually, this tract divides into medial and lateral olfactory stria, right, as well as an intermediate olfactory stria also, which reaches down here to the olfactory tubercle. And this area between here, this is the optic chiasma, optic tract. This area medially, this is called the antiperforated substance, which is bounded medially by this olfactory tract, and laterally it is bounded by this area called the uncus. Uncus is supposed to be the secondary center of olfaction. Okay, so this area here is the primary olfactory area, which includes the anterior perforated substance. Then there are other gray matter embedded around. This is periamygdaloid area and prepyiriform nuclei. Together that forms the primary olfactory area. Okay, so now this is about the olfactory pathway. You've been taught about these are the receptors as well as the first order neurons through the prepyiriform palate, then they bundle up and then they reach in 16 to 20 nerves to embed it into this olfactory bulb, the synapse with the glomeruli formation with the tufted and mitral cells. Now look here, the majority of these fibers, majority of the fibers from mitral cells, they reach through this lateral olfactory stria into this primary olfactory cortex. As I told you, primary olfactory cortex is around the anterior perforated substance, periamygdaloid area and prepyiriform area. There are lots of fine nuclei embedded, and that's all forming the primary olfactory cortex. From here, you have got this is the first order neurons, second order neuron, and the third order neurons from primary to the secondary area, that is uncus. And the secondary area, actually olfactory area, includes not only uncus but also the anterior portion of the parahippocampal gyrus, and together the two, uncus and parahippocampal gyrus, the anterior portion, together forms this area called entorhinal area. Got it? That's a secondary olfactory area. So there will be third order neurons reaching from primary to secondary olfactory area. Okay, but think about this, some fibers which pass straight through the intermediate stria and then dip into this olfactory tubercle. Got it? However, few of the fibers, let's say from the tufted cells, they've passed for the medial stria, olfactory stria, and then they cross the median plane through the anterior commissure, and from there they reach to the opposite, again U-shaped pattern, and they reach to the olfactory bulb to synapse with the granule cells. Remember the molecular layer I told you, so they will be the granule cells, it will pass down there. So if there is a slicing of this anterior commissure, of course there will be alteration in the power of smell, because have this in mind, this is a really very complex pathway, like hair smelling pathway, like because smell can, is a pleasant smell, or sometimes it's an annoying smell. So you have different effects with the type of smell. Now another way of representing thing is, because some authors they say, I told you the ascending tracts, the neurons, first, second, third, fourth category of neurons, which are classified only from the receptor to the primary sensory areas. Got it? So then there is actually no need of classifying it into tertiary or second tertiary or quaternary, or you can say third order or fourth order neurons, because once the sensation has reached to the primary area, from there the fibers are called association fibers or commissural fibers, right? So but some authors have written it as third order neurons. Now third order means communication between primary and secondary olfactory areas. So as I have already told you, that sense of smell is perceived in both primary and secondary olfactory cortex. Means if you are smelling, maybe good or bad, the power of smell is there. That means your primary olfactory cortex is working. So smell is perceived, learn this, that smell is perceived in primary and secondary areas. Got it? Maybe only in primary and secondary means there is this first and second order neurons are intact. By this we means, if this you have this power of smell, your first order and second order neurons are intact. Okay, now look here how this they have divided is from here the mitral central tufted cells. These are the central processes, the lateral stria, olfactory stria, and look here they have given it as this is uncus, and this much area is they have divided considered as entorhinal area, which is actually the anterior portion of the parahippocampal gyrus. So together this area is the secondary area. Now about the anterior perforated substance is this, right? This is the anterior perforated substance. So and this is the amygdaloid. So this anterior perforated substance and surrounding to amygdaloid, there are periamygdaloid nuclei as well as prepyiriform nuclei. So you can say that primary olfactory cortex is made up of anterior perforated substance, periamygdaloid area and prepyiriform areas, right? In if case is secondary olfactory area, you can say it is entorhinal area. And entorhinal area, I told you, it's comprised of uncus as well as the anterior portion of parahippocampal gyrus. Tertiary olfactory area, actually tertiary olfactory cortex means the highest center of olfaction, and that tertiary olfactory center is posterior part of the orbitofrontal gyrus, right, on the base of the frontal lobe. So actually first or primary olfactory area is meant to perceive the smell. You have this power of smell, maybe good or bad. Now the secondary olfactory area makes you relish this smell. If it's good, you will enjoy it, and if it's a bad smell, you will be annoyed with it. So this hating a smell or relishing a smell, this is the power you are getting from the secondary olfactory area. Then the highest of the tertiary olfactory area, this area is actually for your retaining the memory of the smell for your future reference, because you have like if your eyes are closed and something tasty food comes in front of you, is placed in front of you, and you will, without being seeing it, you can tell that it's the smell of like or something tasty which you like it. So that means you are this power of memory, the sense of olfaction is stored in your memory, and it is related to that item or the food which you know. So that means the tertiary olfactory cortex is for the saving the memory of the smell for your future reference. So olfactory afferent pathway comprises only of two neurons, right? So there are two neurons which form the afferent pathway, primary and secondary. right? And beyond that, it will not be considered to be a part of olfactory pathway because those are association neurons. But according to some authors, they have written as third order neurons are located in the primary olfactory cortex, and they go to the secondary olfactory cortex, that's called entorhinal area, which is located in the uncus and anterior part of the parahippocampal gyrus. This much area is the secondary olfactory area, which is called entorhinal area. Okay. Now olfactory pathway further in its course, right? From the secondary, they will reach to there will be fourth order neurons, which will reach to the higher areas, that is, orbitofrontal gyrus, the base of it. So the fourth order neurons connect the secondary olfactory cortex to the tertiary olfactory cortex, right? And that is the posterior part of the orbitofrontal cortex. Some impulses from uncus. Now look here, this third and fourth order neurons, you may not consider them as the afferent pathway because they can also be called as association fibers connecting the different areas of the cerebral cortex. So actually your afferent pathway is only primary and secondary order neurons. Okay, now what's the use of smell? Think about, like, if you are happy with the smell, if you are annoyed with the smell, there will be some response of your body according to that, right? So let's imagine, like, if you are smelling something tasty which you enjoy eating food, like something placed in front of you, let's say biryani or samosas placed in front of you, and what happens is, like, with the smell, you start salivating, and that increases your appetite. It's like an appetizer, right? We haven't tasted the food yet, but still there is salivation, and the gastric secretions also begin. So that actually increases the desire of having food. The other utilization is the smell is also utilized in the sexual arousal. Some smell actually arouse you for sexual activities. And think the negative way. If the smell is pungent, irritating, obnoxious smell, you might not even like having a food at that time. You might like feel nauseatic, right? And similarly, there are some smells while in course of sexual behavior, sexual arousal, it might be that smell puts you down. You don't enjoy it, right? So it might put you down. So there were both the thing, the positive and inhibitory as well as stimulatory effect on the secretions and in your reproductive pathway as well as in your GIT, digestion pathway. So that's like, this is how. And as I told you, that olfactory pathway is very much interlinked with your taste pathway. Let's imagine if your nostrils are completely closed, right, and you were asked to have something, to taste something, I bet you will not be able to enjoy the taste with your nose closed. Got it? So olfactory pathway, the fourth order neurons you have been, I told you, and this is for the retention of the memory of the smell for your future reference. Now some impulses from the higher centers, from the secondary centers, from the entorhinal and uncus, what is going to happen? The efferent pathway, let's say, efferent, every sensory pathway has to have an efferent pathway, right? So the efferent pathway is from impulses from uncus, now they reach the salivatory nucleus and the Okay, so I was talking about the efferent pathway. Now efferent pathway is like, you can see here, this is like the entorhinal area, right? So these second order neurons, when they reach the secondary olfactory areas, right, so you can see is the medial olfactory area here. From here these fibers will pass from this medial forebrain bundle. Medial forebrain bundle is this junction from where both the side, right and left, because they through this medial forebrain bundle and through the reticular formation, these are the neurons, the efferent neurons will pass through the brain stem, reaching to the base of midbrain, pons, and medulla. So through the interpeduncular nucleus, you can see here interpeduncular nucleus, they will reach the raphe nuclei of midbrain reticular formation through them, and will reach the salivatory nucleus of the medulla oblongata. You have superior and inferior salivatory nucleus as well as the dorsal nucleus of vagus in the medulla. So from where they will stimulate the salivary secretion as well as the gastric secretions. So that's the efferent pathway. Got it? Some impulses of uncus reach the salivary nucleus, dorsal nucleus in vagus in the medulla via the medial forebrain bundle, and the reticular formation. Okay. Now the olfactory cortical areas you can see is this olfactory tract. This is the medial and lateral olfactory stria. This is an intermediate olfactory stria which reaches into olfactory tubercle. Now what about this lateral olfactory striate area? You can see it reaches to the gyrus semilunaris. This is called gyrus semilunaris. Okay, and this is the anterior perforated substance. Now look here. This, as I told you, is uncus. Uncus ke further subparts. What are the subparts of uncus? Is actually uncinate gyrus. Then you have tail of dentate gyrus and intralimbic gyrus. So these are the three gyrus. They form the uncinate lobe, the secondary olfactory area. Then part of these and primary olfactory area, as you can see, is the gyrus ambiens here, right? This gyrus ambiens, and this is the medial one, right? So you have the diagonal band of Broca's. This surrounds this forms the medial boundary of anterior perforated substance. So I told you that this one is parahippocampal gyrus. So anterior portion of parahippocampal gyrus. Okay, so we're talking about olfactory cortex, and that's made up of primary and secondary olfactory areas, right? So primary olfactory cortex, I have been telling you that, remember that these three words, anterior perforated substance and the preamygdaloid area, surrounding to this is preamygdaloid area and the prepyiriform area. Together these are small little gray nuclei embedded around to this anterior perforated substance that form the primary olfactory cortex, and that is classified according to Brodmann's is as area number 34, and even 28 also is included in this. So that's the primary olfactory area. So from here you can see these are the association fibers, so you can see the tertiary neurons from primary to the secondary, that is uncus. Got it? Okay, so now about the Brodmann's area. Look here, in humans, Brodmann's area number 28 and Brodmann's area number 34 together constitute approximately the entorhinal cortex. Basically, some authors might have given, you'll become confused, right? Because some authors say it's 28, some have written it's 34. So let me tell you that it will be a better way to understand that entorhinal area. As I told you that entorhinal area was including uncus plus the anterior portion of the parahippocampal gyrus. So this area is entorhinal area, and this area includes the ventral area. 28 is ventral entorhinal area, right? And area 34 is the dorsal entorhinal cortex on the parahippocampal gyrus. So just remember that in case if they ask like olfactory cortex, what a Brodmann's area it is, so on the ventral aspect of the parahippocampal gyrus it's 28, and on the dorsal portion of the entorhinal cortex it's area number 34. So 28 and 34 together form the olfactory cortex. Now in case if sometime they ask you like in an MCQ form giving the 4 choices, which is the secondary olfactory area, or then 28 and 34 are separate choices, right? In that case I would suggest that 34 will be a better option, area number 34, because 28 is a subpart of area 34. Okay, so that was about the Brodmann's area of olfactory cortex. Just for your revision, because you've studied so much regarding olfactory pathway, just have a sort of quiz sort of thing. You can recollect what is area number 1. I believe you know that area number 1 is olfactory bulb. Now what is area number 2? Area number 2 will be the secondary neurons. These are mitral and tufted cells. And what is area number 3? Area number 3 is the perforated ethmoid prepyiriform palate of the ethmoid. What is area number 4? It is the mucosal lining of the olfactory epithelium. Not rather mucosa, the better way is olfactory epithelium, because mucosa even covers this area down below. So this is the olfactory epithelium, which has, you can say, the cytons of the first order bipolar neurons. 6th, of course, is the first order bipolar neurons, cytons, and these are the peripheral processes, these are the central processes. We got it. And 5th is the synaptic glomeruli. These are formed by the central process of the olfactory nerves with the mitral and tufted cells. So these are the synaptic glomeruli, basically mainly with the mitral cells. Okay. Now there's some special points of interest about the sense of olfaction. One thing is the amygdala. In olfaction, this is the one, this is a part of limbing system. I told you one, olfaction, the efferent will bring about results in your GIT secretion, or it depends upon the type of smell you are inhaling. And another thing is the sexual pathway. So amygdala in olfaction processes the pheromones. Now the different categories: pheromones, allomones, chiromones, right? Pheromones means the volatile hormones, or you can say that smell, erotic smell, some from the same species. And cross species is called allomone, and chiromone is cross species where the emitter is harmed and the sensor is benefited. So these are about the chirome, different type of smells which is perceived by the amygdala. Now uncinate fits is also important point of interest, that if there is any lesion in the lateral olfactory area, right, that's entorhinal area, may cause temporal lobe epilepsy, right, or uncinate fits. These fits are imaginary disagreeable odors with involvement of tongue and lips. If somebody has this history of some injury or an lesion in the temporal lobe, so you might find that this person sitting idle keeps on making faces, grimaces, as if he is smelling something obnoxious, and those fits will be seen with the help of, you can see he's making grimaces with the help of his movement of tongue and lips, as he's smelling something disagreeable, and this keeps on happening with him, and that's called uncinate fits or temporal lobe epilepsy. Clinical significance of olfactory nerve. First of all, learn the terminology of different clinical signs. Here, anosmia, like loss of smell, is known as anosmia. Now, anosmia can occur either on one side or on both the sides. So this has to be checked separately, right? So power of smell is always checked with on the two different nostrils separately. So anosmia can occur on both sides or on a single side. Olfactory dysfunction can be total anosmia or incomplete भी हो सकता है, partial anosmia जिसको hyposmia कह सकते हैं और microsmia कह सकते हैं. Distorted smell is dysosmia or can be characterized by spontaneous sensations like phantosmia, right? Spontaneous sensations. And inability to recognize odors, despite a normal functioning olfactory system is termed as olfactory agnosia. Right, everything is working fine here, your olfactory pathway is intact, and still person is not able to smell. That is called olfactory agnosia. Now this can happen because of nasal congestion, because if the air, the volatile जो pheromones हैं, aroma है, that doesn't touches the nasal mucosa. This can happen in such conditions, like where there is nasal congestion or rhinitis, allergic rhinitis and all. So that can be condition of olfactory agnosia. Hyperosmia is a rare condition typified by an abnormally heightened sense of smell, right? Over smelling, destruction of olfactory bulb, right, and primary cortex Broadman area number 34 results in anosmia on the same side of the destruction, right? So this can happen with any fracture of the front of anterior cranial fossa, or any tumor, meningioma and all, where olfactory bulb down below, these are the olfactory nerves attached, and they can easily get torn out if there is a fracture there or any lesion. So that can lead to anosmia on the same side. Irritative lesions of the uncus results in olfactory hallucination. Irritative lesions of the uncus, olfactory hallucinations, right? And that can also lead to temporal lobe epilepsy, as I told you, uncinate fits also. Damage to the olfactory system can occur by traumatic brain injury can be one cause, cancer or any infection or inhalation of toxic fumes which might damage to the neurons there in the nasal mucosa, or neurodegenerative disorders such as Parkinson's or Alzheimer's disease. So these are the various conditions in which there might be damage to the olfactory pathway. Okay. Now causes of olfactory dysfunction क्या हो सकते हैं? One is advancing age. The age is the strongest reason of olfactory decline in a healthy adult. I told you initially that there were around 16 to 20 million neurons in the nasal mucosa, right? And this number of neurons, this keep on decreasing with time and age. So age is one important reason for loss or decreasing loss of smell. The increasing loss of smell keeps with age. So age is one of the strongest reasons. Then the basis of age related changes in smell function include closure of cribriform palate is one, because ossification keeps going on with the age. So these are minute foramina in the cribriform palate. If they are being ossified, the number of nerves reaching to the olfactory bulb will be reduced in count. So one reason is closure of cribriform palate, and cumulative damage to the olfactory receptors from repeated viral or other insults throughout the life. And throughout the course of life you must have faced rhinitis, any allergic infections of the neural mucosa, any pungent strong smells if you are working in such atmosphere. So these type of irritative lesions might also keep damaging the nasal mucosa with age. So that's all which counts. Like ultimately with age you find that is decrease of power of smell. Viral infection is the most important cause. Most important cause, if it say is about loss of smell or decreased amount of smell, is viral infection. Remember, it is the most important cause of permanent hypoosmia. What is the most important cause of permanent hypoosmia? That is viral infection. And anosmia are upper respiratory चाहे इनको अपर रेस्पिरेटरी इन्फेक्शंस कह सकते हैं, ठीक है. तो दोज आर एक्चुअली वायरल इन्फेक्शंस लाइक वायरल राइनाइटिस. सो परमानेंट हाइपोऑस्मिया के बेस्ट कॉमन रीजन में ये आता है, रेस्पिरेटरी इन्फेक्शंस, URTI, वायरल इन्फेक्शंस. Exposure to toxic chemicals, chronic exposure to some airborne toxins such as herbicides, pesticides, solvents and heavy metals. This can be an industrial hazard also for the people who are working from a long time in such hazardous toxic chemicals because of the inhalation of long time inhalation of these irritants that can also damage the nasal mucosa. Head trauma. Head trauma, occipital and side impact causes more damage to the olfactory system than the frontal impact. This is very important. There's a recoil, there's a brain floating in the skull. So if you bang your front, if you bang with your frontal bone onto while during an accident, if there is a trauma on the front of the skull, there are more chances of visual damage, because visual pathway, or the you can say occipital lobe, that is posteriorly, so the brain actually hits the occipital bone. So, and in case if there is a trauma to the posterior aspect of the skull, there it's the more chances of olfactory damage. So occipital and side impact causes more damage to the olfactory system than the frontal damage. And of course, if there is a fracture of the front of skull, or you can say base of anterior cranial fossa, there will be CSF rhinorrhea, because CSF will start leaking to the cribriform palate, and there will be CSF coming out to the nose. That is CSF rhinorrhea. Got it? So these are the reasons of head. There are some reasons of olfactory dysfunction. And neurodegenerative diseases includes Alzheimer's and Parkinson's, which also slowly cause loss in or of smell. Okay, so that was all about the olfactory system. I hope you have understood. If you've still not understood, you can revise from the same lecture. Okay, thank you.